Yes, I hope everything is clear now. Okay, so I think we'll start with the session. I think in our query which we asked in the group, you guys requested for like discussing some NEET PG previous questions regarding to pharmacology. And here we are, we'll be discussing some like a very high yield questions so that we can understand a lot of points. These topics are also going to be important for your medicine, be it your professional exams, be it final exams. You can just take down these notes and utilize it for the exams also. We'll start with the first question. We'll start with the first one. Which one of the following drugs inhibits neprilysin and ACE enzymes? Which of the following will inhibit neprilysin and ACE enzymes? So the answer for this question, if you are there, you can just put it up in the chat box, and we can have an interactive session also. First of all, we need to know what exactly is neprilysin and what exactly are the ACE enzymes. Most of you would be knowing about ACE, angiotensin converting enzyme, but what about this neprilysin? I'll just give you a small example, small explanation about that. Consider here is where your heart is, right? We have the heart over here, and we have the right atrium, right ventricle, left atrium, and left ventricle. Whenever there is too much fluid load, right, whenever there is the blood volume is getting increased up, what happens is there will be enlargement of this left atrium here, because blood is getting accumulated more. There will be the left atrial muscle fibers is going to get stretched out. Whenever it is getting stretched out, the body will sense that there is too much amount of blood inside the body, and the atrium, from which there is going to be release of certain molecules named as atrial natriuretic peptide, ANP. Atrial, I will just write it down, atrial natriuretic peptide. So from the name itself, as we can guess, it is going to be a natriuretic peptide, which means it's going to be excreting out sodium from the body. So when sodium is getting let out from the body, water also will be let out. When water and salt is getting let out from the body, we can easily guess the blood volume is going to get decreased. So this atrial natriuretic peptide, whenever it is getting released, this molecule will bind with its own receptor. This is the receptor for atrial natriuretic peptide, which is there on the surface of any cell, right? So on the cell surface, there will be atrial natriuretic peptide receptor, which is named as natriuretic peptide receptor, NPR. Please note down all these points are also very much important for medicine exams too, even for your final year exams, because currently these neprilysin related drugs are the drug of choice for the treatment of chronic heart failure. So this natriuretic peptide receptor, over which the natriuretic peptide will come and bind, intracellularly it is going to be coupled with guanylyl cyclase. So whenever this guanylyl cyclase is getting stimulated, GTP will be converted to cyclic GMP. This cyclic GMP in turn is responsible for vasodilatation and natriuresis. We have kept it as simple as possible. Good. So whenever the atrial fibers are getting stretched out, atrial natriuretic peptide is getting released, which will bind with natriuretic peptide receptor, thereby stimulating guanylyl cyclase, which in turn will increase cyclic GMP, thereby vasodilatation and natriuresis will be happening. Whenever there is vasodilatation and natriuresis, we can easily guess the blood volume is going to be decreased up further. But you have to understand a simple concept, and that is these are all peptide molecules, like atrial natriuretic peptide molecules. And peptide molecules mostly are going to be extremely short acting in nature. It is not going to be a longer acting one, it is going to be a short acting one. Why? Because any peptide molecule will be quickly broken down by peptidase enzymes. So here this atrial natriuretic peptide molecule will be broken down by a peptidase enzyme called as neutral endopeptidase enzymes. See, all these names which we are actually currently explaining are very much important, buddy, because that's how the concept is going to be explained. NEP stands for neutral endopeptidase. One of the subtypes is neprilysin. Now you could understand what exactly is neprilysin. So neprilysin is an enzyme which is responsible for breakdown of the natriuretic peptide molecule. So because of it, what happens? Vasodilatation and natriuresis, even though it has been produced, that is not going to be long lasting. It is going to be short acting. Why? Because of the powerful neprilysin enzymes. Now, consider a patient is in congestive cardiac failure, which means what exactly is the concept of CCF body? The heart is unable to pump out enough amount of blood from it. The ability of the heart to produce enough amount of cardiac output is getting compromised. That's what heart failure actually means. So here, because the heart is unable to pump out enough amount of blood, more amount of blood will be accumulated inside the body, in the periphery. Thereby, there will be increased blood volume. Simply, there will be increased preload and increased afterload. What exactly is preload and afterload? That will be discussed up in a separate session, guys. Good. So just note that the load on heart is going to be increased up further. Now, in these cases, we need more amount of water to be thrown out from the body because we have to decrease the load on heart. So what we do, the primary treatment process in a patient with heart failure is, I have to throw out water from the body. I have to throw out salt from the body, which is better, which is good being done by this atrial natriuretic peptide. But unfortunately, the action is not long lasting because of the neprilysin enzymes. So what we did, we designed a drug which might inhibit this neprilysin enzyme. Good. And this drug which might inhibit neprilysin enzymes, example, we have sacubitril. Sacubitril is a drug which tend to inhibit this neprilysin enzyme. Thereby, the atrial natriuretic peptides will be acting for a longer time, more vasodilatation, more natriuresis. Good. Sacubitril is the drug which tend to inhibit neprilysin enzyme. So when you come across any of these questions as related to your natriuretic peptide analogs or even neprilysin inhibitor, this simple diagram would be suffice, will be more than enough to write it down in your exams too. Now, here the question is not about that, right? So here, if the question is which one of the following drugs inhibits neprilysin alone, then the answer would be sacubitril. But here the question is not that. The drug which will inhibit both the neprilysin and angiotensin converting enzyme, ACE enzyme. How do we narrow it down? How do we find out what exactly is that drug? See, if a drug is inhibiting neprilysin or simply NEP inhibitors, drug names will be ending with trill, like sacubitril is there. ACE inhibitors. ACE inhibitors are those drugs which tend to be ending with pril, which means your captopril, enalapril, lisinopril, perindopril, all the ACE inhibitors. Now, when we have dual NEP inhibitor plus ACE inhibitor, when both of these enzymes are getting inhibited, now this drug name is going to be ending with trilat. The drug name will be ending with trilat, and those drugs are omapatrilat and sumapatrilat. Omapatrilat, sumapatrilat. These drugs are being designed in such a way that it might inhibit both NEP and AC inhibition and AC enzymes. And this omapatrilat, sumapatrilat, do we have that in the options? Yes, we have option D. Omapatrilat is there, and that is the answer for this question, guys. Omapatrilat is the answer for this question because the drug which inhibits both neprilysin and AC enzymes is omapatrilat. What about this one, guys? Nesritide. Nesritide is actually a BNP analog agent, brain-derived natriuretic peptide analog agent. That is what nesritide is. When you study about nesritide, you just need to remember one very, very important point, or one we can keep it as two, two extremely important points. And regarding your nesritide, one, it is used only for acute heart failure. It is not used for chronic heart failure. It is used only for acute heart failure. The second point is regarding the adverse effects. This drug might be producing nephrotoxicity. This drug will be producing nephrotoxicity and hypotension. Two important points which you have to remember, my dears. One is regarding for which condition do we use nesritide, acute heart failure. And the second one is regarding the adverse effects, nephrotoxicity, hypotension. Just remember this nesritide, N is for N, my dears. Nesritide is associated with nephrotoxicity. Losartan, what is losartan? Artan, if the drug name is ending with artan, we can easily guess it is an angiotensin receptor blocker, angiotensin receptor antagonist agent. Now here, what we have did is this omapatrilat and sumapatrilat, both the drugs are there, currently we don't use that drug in practice. Why? Because it produces very severe angioedema. It produces very severe angioedema, and that's why these two drugs are not being recommended right now. Instead, what we did, the primary reason for that is inclusion of AC inhibitors in that. So what if I change that AC inhibitor with ARB, angiotensin receptor blocker? What if I do that? The job is done. The angioedema will not be happening. So we have designed a drug which is a combination of NEP inhibitor and angiotensin receptor blocker, which means drugs which are ending with ARTANs. ARTAN drugs. ARTAN stands for angiotensin receptor antagonist agent. That's what ARTAN drugs are. So your losartan, irbesartan, candesartan, valsartan, we have lots of drugs which comes under ARBs and neprilysin inhibitors, especially your sacubitril. So we have a drug combination named as sacubitril valsartan combination, and that is what currently the first treatment of choice for chronic heart failure, especially in Asian population. Good. So here, that's the reason why the answer for this question is going to be umapatrilat. So lots of one-liners from this, my dears. First one line is regarding nesretide, acute heart failure, nephrotoxicity. Sacubitril, which is a neprilysin inhibitor. Losartan, similarly, we have valsartan and sacubitril combination, which is currently the treatment of choice. Omapatrilat, which produces severe angioedema, that's why it is not been recommended for the treatment of heart failure, which is the answer for this question. Is it good? So we have discussed about the first question. Moving on to the second one. Pulmonary fibrosis, hypothyroidism are side effects of which of the following drug? Pulmonary fibrosis and hypothyroidism are side effects of which of the following drugs? See, this concept is recurrently been very much like repeatedly this question has been asked in a lot of different exams, primarily for the adverse effects of a single drug, which is amiodarone. The answer for this question is actually amiodarone. First of all, what are the adverse effects of amiodarone? This is an important question. Amiodarone, whenever it has been administered, is actually an anti-arrhythmic agent, buddy. It has got a wide spectrum of action. It's an anti-arrhythmic agent. For when you administer amiodarone for a patient, we can expect, yes, Dr. Shreya, you're right. The answer is option A. Amiodarone is the answer for this question. Whenever you are being forced up with the question regarding amiodarone, you have to remember the adverse effects. Most important one, I'll give you a mnemonic to remember those adverse effects too. That mnemonic is very much simple. Nilesh is the mnemonic. Nilesh is the mnemonic. I hope you know who is Nilesh. That's what me known for. So N stands for neurotoxicity. N stands for neurotoxicity. Patients might develop proximal muscle weakness. I remember high. I remember high. Patients will be, or amiodarone is a drug which tend to have high volume of distribution, high spectrum of action, and high duration of action. High spectrum of action, high duration of action, classical features of amiodarone. L stands for lungs. In lungs, patients will develop pulmonary fibrosis, and that is what this patient is actually having, pulmonary fibrosis. E stands for eyes. Patients might develop corneal microdeposits. Corneal microdeposits, which is actually asymptomatic and reversible in nature. Asymptomatic and reversible. S stands for skin. In skin, it might produce blue discoloration of skin. Also, we can explain it as blue man syndrome. The skin is going to get deposited, blue discoloration will be seen. Also, it has been named as Smurf skin appearance. You know about Smurfs, right? That small blue colored things which tend to have, we have lots of movies also. And the skin will be discolored similar to that. And that's why it is also named as Smurf skin appearance. H here stands for hepatotoxicity. Hepatotoxicity, hypothyroidism more common than hyperthyroidism. Hypotension, the BP tend to fall down. This is one important statement, buddy. We have seen questions asked about that. Amiodarone produces hypertension or hypotension. The answer is hypotension. And the last H is for heart. Patients will develop myocarditis. Patients will develop myocarditis. These are all the adverse effect profile of amiodarone, guys. When you come across a question which is related to your amiodarone, most of the examiners will be expecting you to write down all these points. These points are extremely important. Please follow that up because every year we are facing one question from amiodarone. So here, the answer for this question is as simple as that. Amiodarone is the answer for this question. What about the other drugs? Spironolactone, this is a potassium sparing diuretic. No worry at all because it has got no relationship with pulmonary fibrosis or hypothyroidism. Hydralazine is an arteriolar dilator. It will, because it is dilating the arteries, there will be decrease in the blood pressure, but thyroid values or lung values will not be affected because of hydralazine. Atenolol is a beta blocker drug. It has got no relationship with the lungs. It will produce bradycardia. That's the primary adverse effect of atenolol, guys. So these are the important points about pulmonary fibrosis and important points about amiodarone. Moving on to one more question, we'll discuss one more question and then we'll just wind up this session, my dears. This is an important statement. Drug of choice for dialysis disequilibrium syndrome is. We used to call them as DDS, dialysis disequilibrium. First of all, we have to know what exactly is dialysis disequilibrium syndrome. See, consider here is where your blood vessel is. We have the blood vessel. Inside the blood vessel, we have water molecules. We have water molecules and we have salt. Yep. We have salt and water molecules. Now consider this patient is suffering from renal failure. This patient is suffering from renal failure and they are going to be put under dialysis. So what exactly we do with the dialysis? Salt is getting excreted or water is getting excreted? Primarily, we will try to excrete out salt by dialysis. Why? Because when you excrete out water, even when water also is getting thrown out, the blood volume will be decreased. When the blood volume decreases, the patients might progress on to hypotension. So to prevent that, usually water will not be excreted more because of the dialysis machine to maintain the blood volume. But unfortunately, what happens when more amount of salt is getting let out, this fluid or the blood is getting more dilute. I'll repeat that. When the salt is getting let out, we know that that particular fluid is getting more dilute because when salt is there, the fluid will be concentrated. Here, salt is getting let out, so the fluid is getting diluted. Now, in comparison with intracellular fluid, this is your intracellular fluid. In comparison with the fluid which is present inside the cell, the fluid which is present inside your the fluid which is present inside your blood vessel is going to be more dilute. So there will be an equilibrium mismatch. So what happens to maintain the equilibrium? The water molecule from the blood will start moving into the intracellular fluid to maintain the equilibrium. So when the equilibrium is trying to get maintained, water, we thought a lot, we designed the dialysis in such a way that the water is not getting let out, but unfortunately, water is moving out of the blood vessel into the intracellular fluid. So what happens at last? Because water is getting let out, there will be a decrease in the blood volume. When the blood volume decreases, there will be decrease in the blood pressure. Patients might land up in hypotension. This is what explained as dialysis disequilibrium syndrome or DDS, dialysis disequilibrium syndrome. Now, how do we treat that? The primary concept here is water is moving out of the blood vessel. So what we need the water molecule to be accumulated there inside the blood. How do we accumulate it? I will give certain drugs which will keep the water inside the blood vessel. We have to make sure the water is not moving out of the blood vessel. So which drug will keep the water inside the area where the drug is actually? And that is what your osmotic diuretics are. As the name itself implies, osmotic diuretics. See, we have lots of sponges here and there. Like sponge is there for absorbing water and all. That sponge is nothing but an osmotic diuretic. That's how the osmotic diuretic works. When you administer that drug, this drug will be there inside the blood vessel. It will attach with the water molecule, prevents the water molecule from moving out of the blood vessel. So here, the treatment of choice would be an osmotic diuretic, which is actually mannitol over here. Mannitol is the answer for this question. The other drugs like ethacrynic acid, be it ethacrynic acid, which is actually a loop diuretic. What point do we need to remember about ethacrynic acid? This is the one which produces maximum ototoxicity. The drug which produces maximum ototoxicity out of all the loop diuretics is ethacrynic acid. Bumetanide, again, it is also a loop diuretic. Nesritide, most of you would have known it. What's nesritide? It is a BNP analog agent which is used for acute or chronic failure. It is used only for acute failure. And one more point about nesritide, it might be associated with nephrotoxicity and hypotension. Right, guys, we have discussed like few questions which are very much high yield for your exams also, and also for your prof exams too. And this is just for the kickstart of the sessions. We'll be having lots of sessions followed up from this particular one, and we'll be having a thorough discussion in the WhatsApp group. It will be displayed up soon, and we'll meet up in one more session pertaining to pharmacology, and also which is interlinking with other subjects too. We'll be going with vertical integration and horizontal integration with other subjects too. We'll be having lots of sessions. Please stay back and join up for all the sessions. Only if you join, it'll be good for us also. Bye bye, good night, and we'll meet up in one more session. Bye bye.